This is Ken Sharp with the Iowa Department of Public Health. We have a handful of slides today to go through. Again, expect a fairly short webinar today. Not a lot of information, but we do have a fair number of resources to share with you. I do want to take just a moment and welcome Emma Gelman. She is our CDC Public Health Advisor that is assigned to the Immunization Bureau. Emma's been with us for a while now, but you will hear from her later today for the first time, and we welcome Emma to the team here at Iowa. We're excited to have her with us. And others that work with the Immunization Bureau, you'll have opportunities to get to know Emma a little bit more detail as we come out of the pandemic and return to focus on traditional vaccination efforts. Questions and answers will be again handled in the Q&A. If you place anything in the chat room, you will be asked to redirect your question to the Q&A, and we will handle questions there throughout the webinar and any remaining questions at the end of the slides. And then, as we've noted before, this webinar link has in the past been shared with media, and we may have media joining us today listening in to the webinar. So with that, we'll just go ahead and get started on our first slide, and then we'll transition over to Bethany for some information on vaccine updates. So we do want to just share with folks the information that is coming out of CDC and other locations is slow enough. We feel like we can transition, similar to what the Center for Acute Disease Epi did, transition to an as-needed basis for these webinars. So today will be the last scheduled webinar, and we will schedule as new information becomes available. We do not have a set time or a goal for the schedule. We will just truly update scheduling as needed based on information that comes out. We will also be transitioning the vaccine information brief that we've been sending out weekly in coordination with the webinar to an as-needed basis, and so look for that transition as well. However, we do want to make sure that everyone understands that the call center and the vaccine email for COVID-19 will remain active and available for healthcare provider questions. So feel free to continue to reach out to those questions and or those resources if you do have questions. So with that, I think I'm going to transition over to Bethany to cover some updated CDC information.
Good afternoon, everybody. This is Bethany with the Immunization Program. I just have a few slides on some new resources that are now available. We've had lots of questions on the pre-vaccination checklist, and they finally have updated it in 6 different languages. And on each of the vaccine products page, you will be able to find the vaccine checklist in the different languages. I believe those are also posted on our webpage. Next slide, Ken. So this is new. We already have been returning the Pfizer shipper containers, but McKesson is now requesting that the Moderna shippers are returned. There are labels and instructions on the inside flap of the box, and you can just follow those instructions and have those shipped back. If you have questions about returning those, I did include an email that you can use to reach out to McKesson. The thing that we really want to point out is please do not return vaccine in the thermal shipper containers. CDC has had some jurisdictions doing that. Iowa has not had any to date. I'd like to stay that way. So please return those shipper boxes, but do not put the vaccine in there to return. Next slide, Ken. So the COVID-19 vaccine expiration date. So we have about 450,000 doses of COVID vaccine in inventory across the state. So we want you to be please making sure that you are checking the expiration dates before you are administering any of the vaccine. And then per the COVID provider agreement, to go ahead and make sure that you're reporting the number of wasted, unused, spoiled, or expired doses in IRIS. And then we did include the 3 sites that you can check for each of the vaccines to determine what their vaccine or their expiration date is. Next slide. And then I'm sure everybody has heard the good news that FDA approved the shelf life extension for the J&J vaccine. They increased it by an additional 35 days. They did have some stability studies that went on and that showed that it was viable at that temperature when stored appropriately. So please go out and do the vaxcheck.j&j to confirm the latest expiration date, and then go ahead and update those expiration dates in IRIS as you find that they are continuing to extend. Next slide, Ken. And I think I'm going to kick it back to Ken. Thank you.
Thanks, Bethany. So we do have some information that we received late in the week, last week, or into the over the weekend, that we need to update everyone on, related very specifically to Johnson & Johnson. And we apologize for the late breaking nature of this. It is not information that we had a heads up on either, but we do need to communicate some things to you with respect to the Johnson & Johnson vaccine shipments. They have been paused, and they have been paused indefinitely. So the orders, if you are a county or a vaccine provider who placed an order through the state of Iowa last Thursday, we will not be receiving those shipments. And it's our understanding that that decision has been made indefinitely. What the primary focus here is, the CDC partners are saying states have adequate supplies of Johnson & Johnson vaccine in inventory among vaccine providers, and that the states and the vaccine providers need to work on redistribution of those vaccines, particularly in light of the upcoming expiration dates, even with the extension of the expiration date that Bethany was just reviewing. We do not have any visualization or information as to when Johnson & Johnson new shipments will resume. So for the time being, what we are asking is, if you are a healthcare provider in need of Johnson & Johnson, we do have a map, and we'll cover that here in just a moment. And we're asking you to work with local public health on requesting redistribution of Johnson & Johnson doses. There are some counties that have many doses of Johnson & Johnson in inventory, and there are appears to be ample opportunities to do some redistributions of those doses. Although local public health may not have doses of Johnson & Johnson directly, they are able to view inventory of the providers in their county, and they can assist with redistribution coordination if there are those needs. And currently, this pause applies only to the Johnson & Johnson vaccine. We have not received word that there will be pauses or delays on shipment for the other two products, but we will continue to watch that closely and share that information with you if it does become an issue. We also have ample doses of Moderna and Pfizer in inventory in the state of Iowa. And so we want to make sure that as you look particularly at the Johnson & Johnson product, if you have a need, there are some resources to help you out in trying to identify where you can make some requests from your peers to redistribute some of the doses. We will continue to send our survey out weekly that we have for the last few weeks since the 1st of June. But we want to make sure that we communicate very clearly that we are encouraging healthcare providers to work with surrounding providers and counties on redistribution efforts, particularly as we watch expiration dates approach us on the calendar. We think that there is going to be some expectations from our federal partners to focus on full utilization of the existing vaccine supply that we have within our state, and that will necessitate efforts to do redistribution. So specific to the Johnson & Johnson vaccine, this is the map of what we currently have in inventory as of June 13th at the end of the day. So you can see where there are doses across the state. You can see the counties that don't have any inventory of Johnson & Johnson. Across the state, we have had over 30,000 doses. The week prior, it was about 33,000 doses. So we will continue to update this on a weekly basis, and it will be made available to our local public health partners to help navigate those requests. Just a reminder again of our allocation changes. This has been now since the 1st of June. We will send an email survey request on Mondays, and that response is due Tuesdays at noon. Each county will be able to request the number of doses they need for Pfizer and Moderna. And we hope at some point we'll be able to return with a Johnson & Johnson offering, but that is on hold until further notice. We do ask that even if you are not requesting an allocation, to go ahead and still complete the survey. It just helps us clearly document the need or lack thereof each week if you do complete the survey. However, if you don't, we will just move on without you, and there will be no allocation made. Again, just a reminder that the vaccine survey request that's sent out on Monday, we should make sure that you're including all of your prime and boost dose needs. We are no longer separating or ensuring a boost dose allocation to meet your prime dose allocations based on that order. So you need to make sure that you have a clear understanding of what your overall needs are and report that in the survey. Our final decision regarding allocations will be based upon the availability of the vaccine and the vaccine presentation. So for example, if we at some point run out of the Pfizer or no longer have access to the Pfizer 1170 packaging, we will have to substitute that for the Pfizer 450 and such. So just understand that there may be some variations in final decisions. I don't think we are at a point right now where that is a high likelihood of impact, but that may change in time. And so just understand that you may need to adjust accordingly if we do have to make some adjustments on your order. Once you've submitted your email survey, the allocation process will remain the same, and you will go into the IRIS database to place your order on where those doses need to be shipped. Again, that will be, as it has been, the IRIS notification for HAN will go out on Wednesdays at 8:30. And then you have until Thursday at noon to place your order. And then we place our order on Thursday evenings, and then shipments begin the next day or early the following week. Just to give you a sense of the orders that we placed on Thursday of last week that will be arriving this week, we had 22 counties indicating a need for a vaccine. We had 1 flat of Pfizer ordered, 15 flats of Moderna, and we did have 2,100 doses of Janssen or the Janssen product placed. However, those orders are on hold and will not be shipped. For those of you that are amongst those counties that placed the 2,100, the order for 2,100 doses of the Johnson & Johnson product, we would ask you to refer to that map that we provided earlier and make a request of your neighbors for redistribution efforts. So with this, I'm going to transition over to Emma. Emma, welcome to the team. We've had you around here for a while. We all know you, but give you an opportunity to introduce yourself to the attendees, and then we'll let you go through the materials that you have for today's presentation.
All right, thanks, Ken. Quick sound check. Can you hear me?
Yes, we can.
Okay, fantastic. Thanks so much for that introduction, and good afternoon, everyone. I joined the Iowa team in February. I am an Iowa native, originally from Iowa City. I've been in Chicago for the past 5 years supporting the Chicago Department of Public Health, so I am really excited to be moving back to my home state. So thanks again for the warm welcome from the Iowa team. Today we wanted to share with you some findings from the COVID-19 State of Vaccine Confidence Insight Report, as well as some newish resources and opportunities that are available as part of some national campaigns to continue the momentum to encourage unvaccinated populations to get vaccinated. So the CDC regularly creates reports about the status of COVID-19 vaccine confidence in the United States. And the reports include multiple data sources ranging from social listening to web metrics, and they seek to identify emerging issues of misinformation and places where intervention efforts may positively increase vaccine confidence. If you are interested in checking them out, they are available online now on the CDC Vaccinate with Confidence webpage. And the latest report is from May 24th, and we wanted to highlight several continuing themes that have appeared across multiple issues that have been released over the past several months. And I'm sure it comes as no surprise that misinformation is a continuing theme, and here is one example. Claims that mRNA COVID-19 vaccine shed virus, so in other words, people who get vaccinated are spreading the virus. And in addition, there are very vocal vaccine deniers who continue to misrepresent the vaccine adverse event reporting system data, to reduce trust in the safety of vaccines. Next slide, please. It is an uphill battle for sure, but the current recommendations on how best to address misinformation are to continue disseminating messaging to counter these vaccine myths and promote the vaccine benefits in social media, in attempts to create an equally loud, positive voice around vaccines. And I'm sure you've probably seen this repeating concept of a trusted messenger. And this can really be a healthcare professional, a coach, a religious leader, a club leader, a mom. And thinking about this at the hyperlocal level, who is a trusted messenger in the various communities that you are a part of, and getting positive vaccine messages out through those trusted messengers. And you can also share your vaccine experience about why you received the vaccine, or encourage others to share theirs. And there are some new resources out there that make it really easy to do this. Made to Save is a national grassroots effort to ensure that communities hardest hit by the pandemic have access to COVID-19 vaccines. And they've created a really neat tool where you can go to their webpage, record a quick 30 to 60-second video about why you chose to get vaccinated, why is it important to you. And then it's reviewed, they give it subtitles and a modern look with their branding, and then you receive a hyperlink to your video that then you can post on the social media channel of your choice, whether that's Facebook or Twitter or Instagram or TikTok, or who knows what else is out there that I don't even know of. And also included on this slide are links to CDC resources. These may not be new to you, but just a reminder that they are there if you want some quick references for talking points on myths and facts, or to share these resources on how to talk about COVID-19 vaccine. Next slide, please. So the next theme we wanted to share with you is on vaccine series completion. So noted here are concerns highlighted in the report that people are not returning for their second dose, concerns about acute side effects after the second dose, and a belief that one person or one dose will provide sufficient protection. And we can definitely see this trend, whatever the causes may be, in our own data. So this table right here is doses administered from IRIS as of June 9th, showing the number of individuals who have exceeded the minimum interval and are missing the second dose of either the Moderna or Pfizer vaccine series. And what's a little alarming is the number of individuals who are 22 days or more past the minimum interval, about 47,000 people here, who should have had a second dose and now be considered fully vaccinated. And I actually just a little bit ago peeked at today's data, and now we're at just over 50,000 people who are 22 days or more past the minimum interval. And this definitely impacts the percent of the Iowa population that's fully vaccinated. Next slide, please. So some suggested actions here to address vaccine series completion include amplifying messages on the importance of completing both doses, including information regarding the lower effectiveness that could result from not receiving the second dose, and to really reassure consumers, patients, the public who have delayed their second dose that completing the vaccination series is important for protection from COVID-19 illness. And one tool that's available to you is the reminder recall functionality in IRIS to help identify patients needing the second dose. And we've included a hyperlink on these slides when they're sent out after the meeting. You can access it if you would like to on the instructions. And from here, you can run a list of vaccines that are due now or vaccines that are past due. And then you can generate a reminder letter that you can customize, a postcard, mailing labels to accompany them, or you can export the client data out of IRIS into an Excel file. And again, their instructions are on this slide if you would like to utilize this functionality. If you are a county health department, you can run this to view all patients in your county, which is a neat function. And if you are a clinic or provider office, the report will just pull patients from your clinic. And then also under the resources section here, the University of Iowa hospitals and clinics put out a nice short video and talking points on why getting a second dose of COVID-19 vaccine is so important. So you can use or modify those if you need some talking points on those elements. And then VaxText is a free text messaging platform that providers can offer to their patients, and patients can opt in to receive text message reminders to get their second dose. And as an added benefit, it also reminds patients to sign up for vSafe to report any adverse outcomes following vaccination. Okay, next slide, please. So moving on to some national campaigns, We Can Do This is the national COVID-19 public education campaign from the Department of Health and Human Services. And there are a lot of really great resources and toolkits. This clip here is from the landing page from this website. So you can view resources, you can look at social media messages, you can explore vaccine hesitancy. They have a COVID-19 community core that you can sign up for or encourage others to sign up. And as a member, you'll get resources to help build vaccine confidence in your community, including social media content to share, tips for planning and attending community events, and regular updates with the latest vaccine news and resources to share, with the intent of really reaching and focusing on those who are vaccine hesitant, considered kind of those in the movable middle, who are in the wait and see mode. Next slide, please. And then you're most likely aware that June is the National Vaccine Month of Action, with the goal of getting 70% of the US population vaccinated with at least one vaccine by July 4th. So here, Made to Save has teamed up with the We Can Do This campaign, and the websites for both of those are on the screen here. So there's a lot of momentum and a really big national push to reach those who are not vaccinated. And here on the websites, you can see those if you'd like to visit them. And here on the right, you can see the landing page for the Made to Save. So as I shared previously, there's the link where you can click on to tell your story. You can, for the spread the word on social media section, you can click there for some readily available social media messages to share. And then if you click on the attend an event, next slide, please, Ken. Some training and volunteer opportunities come up. So you can sign up for events like a digital storytelling training, or you can look for volunteer opportunities to staff a phone or text messaging bank. And then again, as I mentioned before, there are customizable social media messages that can be shared with a click of a button. So, while these approaches might not be the best vehicle for all demographic populations in Iowa, there are some really innovative tools available that don't require much adaptation that we wanted to share with you today in case you're interested in using them or sharing these resources with your partners and patients, and families, and communities. So I will turn it back over to Ken. Thanks so much for your time today, everybody.
Thanks, Emma. I appreciate all that information. Again, Emma's been a great addition to the team, and we look forward to having her interact with all of you in the near future. So we wanted to just also spend a moment, if you have not seen the recent coverage on the promotional campaign, our communications team did work with General Correll from the National Guard to create a pretty impressive message here regarding obtaining the vaccine. So we wanted to share that video with you here. It's just very short, and then we will also provide you some links on where you can access that. If there are some local campaigns that you would like to do, you are able to use this video. So I'm going to go ahead and play this now. Let me just double check to make sure that I've got the share sound. Yep, okay, so this should work.
I've been deployed overseas 6 times with multiple combat tours. I have had a bounty placed on my head by insurgent forces. I haven't missed a day, a beat, in my career. I haven't been in the hospital since the day I was born. Only one thing has been able to take me down: COVID. And now I've done my part to take COVID down, getting the vaccine.
So if you do have an interest in using that in local media campaigns or other, you can view it on YouTube at this location, or there is a high resolution that you can download from this Google Drive. So if you do have an interest in that and can't access it otherwise, please let us know. It's pretty impressive to talk to General Correll, to just experience kind of the pretty serious health consequences that he experienced and the realities that he faced in dealing with that, and the consequences that he had to navigate. So he felt compelled to share his story and try to help convince those that maybe thought that they would not be as seriously impacted by COVID to reconsider and encourage them to obtain their vaccine. So we thank General Correll for his support on that. And I believe that is our last item for the day. It is. So just for reference again, to note, this will be the last scheduled webinar for the vaccine team. These two options will remain available to you, and we will schedule a vaccine webinar as needed with new and significant information that does come up. I only see one question sitting out in the Q&A from Sam Jarvis. Do we have any projections at the state level on when we will reach major milestones? The short answer on that is, Sam, no, we don't have any projections at this time. We've been looking at, however, our Domo dashboards, both the internal dashboards as well as the public-facing dashboards. We're looking at making some modifications to those to look at some of these percentages of populations completed, and we will see some of that also transition to a public display. And so in terms of the follow-up question, will there be any planned fanfare for those? Not at this point, but we can certainly talk through those. And you know, if you've got some ideas on friendly competition, it sounds like maybe you're willing to challenge some of your peers and wanting to have some of that fanfare opportunity. Would be welcome to hear your thoughts on how we might accomplish that. So feel free to reach out to us, Sam, if you want to talk through that some more. Okay, I'm going to pause for just a moment. I don't see any additional Q&A coming in. Looks like the other two questions were already answered. So with that, we will draw to a close today's webinar. Thank you, everyone, for your time. Thank you for all of your efforts over the last 7 months, particularly as we've started to receive and distribute and administer vaccine. Your work has been outstanding during this time. I know it's been a particularly rough period trying to navigate all of the challenges, but we do, from the department, express our sincere gratitude and appreciation for all of your incredible work. We know it's been some long hours here, and we can only imagine it's been just as much or more so for your work at the local level. So thank you for all of your support and understanding as we transition through some pretty challenging times, but we are, I think, on a very good path to continue to make progress and can really now transition and focus on reaching some of those hard to reach populations. So with that, again, thank you. We will be back in touch, and we will make announcements on our future webinars when we have enough information to warrant a webinar. So thank you and have a good day.